But I really would say just go for it. And I know that sounds like something very cliche that everyone say, but really go for it. If your mission aligns, if the passion is there and aligns with what you feel defines you, what brings you joy, then go for it. Even if you don't think you're qualified, go be a team physician, go start a podcast, do something. If it feels like it's the right thing for me personally, that's helping women, helping adolescents, kids, really promoting that health, especially those who may not be able to find those resources elsewhere, then go for it.
You are listening to the Pinnacle Podcast, where we empower women in medicine through education, community, and actionable strategies for both the practice and the business of medicine.
Medicine is a lifelong career, and continuing education is crucial for professional development. Pinnacle is the first and only multi-specialty organization dedicated to addressing the challenges that all women in healthcare face.
Welcome to Pinnacle, the elite professional community providing education for women in medicine. At Pinnacle, we challenge you to pave your own path by helping you develop the skills needed to not only stay in medicine, but to excel. Welcome, everyone, to the Pinnacle Prescription. I'm your host, Dr. Rupa Wong, and today I am joined by Dr. Jessica Gray, who I am thrilled to have on the podcast today. She is a board-certified family medicine physician. She's also the clinical medical director for the UMC Southwest Family Medicine Clinic and clinical assistant professor at the Texas Tech University Health Sciences Center for School of Medicine. But she also does a lot in her community. She and I share this passion for community involvement, and that's what I would also really love to tackle today. So thank you so much, Dr. Gray, for being here today.
Thank you so much for having me. I'm excited.
All right, well, let's just start at the beginning. We're going to dive right in. Tell us a little bit about your journey into family medicine. That's not a field necessarily that people really understand what the difference is sometimes between internal medicine and family medicine. What inspired you to go into that specialty?
So I went into medical school with a love for so many different things. I absolutely loved every rotation I went through with psychiatry, ophthalmology, all the fun stuff, right? Everything. So I went from things that were specialty, urology, pediatrics, everything, even OBGYN. And so when that being said, I just sat there and I thought, I really want something that encompasses all of these fun aspects. I absolutely love the idea of walking into clinic and having no idea what's behind each door. I think it's really exciting. It works well for somebody who has a lot of maybe some high energy and really wants to just kind of bounce around and not get bored. So family medicine definitely helped with that. I also love the emphasis on women's health was very big in family medicine. Internal medicine, I love them. I have several great friends who are all internal medicine physicians, but there is a little less of a focus on women's health than it has in family medicine, because in family medicine we do a lot of OBGYN care. I trained here in West Texas, where we actually have a lot of rural care, and we do training for rural OB-GYN as well. And so we do a lot of hands-on obstetrics. We assist in C-sections as well, deliver a lot of babies. And so it's very intensive with the women's health as well. So really the idea of I love it all, but really wanted to make the biggest impact for both women and adolescents as well. Family medicine was the perfect fit.
That's so interesting, because I had never really considered it from that standpoint. I think about family medicine being internal medicine and pediatrics, and sometimes I forget that it really does have a lot of OBGYN, of course, in it as well. But talk to us a little more about the women's health education, the passion that you have for that, because I know you're doing a couple things on that side as well.
Absolutely. So women's health, I think, is very, very important topic to discuss. And a lot of times, I'm one of these people as well. You get done having your babies and all of a sudden you say, okay, I guess I need to start seeing maybe a primary care doctor, because your OB-GYN was managing most everything before that. Or before that, maybe you were in college and you went to someone with college health. And before that, you were with a pediatrician. So you may not have known the role for a family medicine physician until all of a sudden you say, okay, now what? And, talking about things like women's heart health is so important, because we present differently with different, with different symptoms for different diseases. It's really just an important thing to have these conversations. I also feel very passionately that we need to talk to our women about not everything we can chalk up to it's your hormones. I think that simple statement right there drives me crazy, because I have women come in and they have just been told by multiple physicians, friends, family members that these things are feeling, it's just their hormones. Well, they come in and see me. It's not their hormones a good 90% of the time. They are diabetic. They have, a thyroid dysfunction. There are a million other things. And we can't always blame it on, the poor little thyroid, but we can find things that are underlying like sleep apnea. There's so many things that really we need to break down and not just label these poor women as it's your hormones or, talking about menstrual cycles and all of these other aspects that we just chalk up to. It's just because you're a woman, you have to deal with this. And there's a lot of it we don't need to or shouldn't have to deal with. And some of it is abnormal that often gets overlooked. And I think my passion as well for women's cancer care is also very suited for family medicine. That the number one cancer I diagnose is breast cancer because I order the largest amount of screenings. We do mammograms. I make sure every single year my patients are getting the screenings they need. I am actively looking for resources for those who are unfunded to make sure that they can get access to screenings as well. And that is the one that I actually get the result back the quickest from. It comes to my inbox and I have to call that patient in, sit with them and tell them that diagnosis. So it's just one of those things that's very female oriented that it really works best having it come from a family medicine physician who knows your whole life and has been seeing you for many years.
And also someone that patients trust, right?
Right.
Explain just the varying screening guidelines because they're changing constantly, especially with respect to mammograms. Do you get it? Do you start at 40? Do you do it every year? Do you do it 45? What is the preventive task force, right?
Right.
I think that there's so much confusion, and if someone has a relationship with you, then they obviously trust your expertise to say, all right, this is when I need to go. But you also touched on something that I think is very important as a woman who has multiple medical problems. I think a lot of these diseases present differently. You mentioned sleep apnea or heart disease, right? And I think having someone that's really attuned to that and not just blaming the hormones for everything might be responsible for the underlying medical disease presentation, right? Talk to us about that.
I definitely think that that is a big passion and one of the reasons that I've reached out into some other avenues, focused on women's health education. But it's one of the things I see quite often, and I like to call it predatory medicine. It's something there you will have a woman especially, we're the moms, we're the women, we take care of our families quite often, right? We take care of our kiddos, we take care of our husbands. I mean, I make his appointments and push him to get those things done, pick up his prescription, but we take care of our people. We're, usually in a tribe that we take care of and we're the leaders. Well, we're also leaders in healthcare quite often as well. But what that means is sometimes we're searching for answers when you're not medical, especially. You don't have this, you're not a physician. And so when you're searching for answers, you turn to what? The internet. We go on to social media. We go on the internet. I have great friends who are not medical, and they send me clips all the time on Instagram, TikTok of these women talking about, you just need to get a parasite cleanse. You just need to do this. I mean, there are so many things that are out there. And so they come to me and say, a parasite cleanse. Yes, this is if you do not know about this, you need to know. This is all the rage right now. Oh, yes. Apparently all of it.
Really? What are they doing for a parasite cleanse? Just to
you buy these online. So there's people online that are selling these kits, and you can do them at home. And and I am not against some holistic methods being brought in. I'm all for acupuncture. I'm all for things that have actual data support. I'm very evidence based. So great, love it if we can incorporate it. But when my patient is spending out maybe like $200 to do quarterly parasite cleanses, where it's some kind of pills plus some kind of drink they drink, and then that says that it cleans their body out of parasites. I mean, and they spend this money and they say, okay, it's going to make me feel better. This is that predatory medicine I was talking about, where somebody is out there and sometimes they do have some medical background, not usually a physician, but sometimes they have some kind of medical experience, and they're saying, okay, you buy my product, you're going to feel so much better. These patients buy these products, they come in to me later, maybe years later, months later, and they feel horrible still. And they say, I've tried all of these. Yes, of course. To us, we think, of course. But to them, they're just frustrated because they're like, I just spent $1,000 of the last 12 months doing all these cleanses and all these things that told me that I was going to feel better, and I don't feel better. And then it turns out, let's say they were doing it for gut health. I hear that one a lot for these quote parasite. Yes. So they're saying that's why I was doing these cleanses. And I say, okay, well, we look into it. I've had more than one time, I've had Crohn's disease diagnosis, ulcerative colitis diagnosis, and they were just sitting there for years taking these supplements, doing these things because the internet told them that way. And I don't blame them. I think that was back to the original point. As being a woman, we're just so in tune to wanting to take care of those around us and ourselves that we're just trying to do our best. And so when you go on the internet and it tells you, do this, a parasite cleanse, you're probably just like, well, I mean, it doesn't hurt, right? And sometimes it can hurt.
Absolutely. And that's, I mean, why so many of us are trying to be on these platforms and taking time to educate, right? I mean, because there's so much of this. I'd never heard that term, predatory medicine. That's a really great.
I think I coined that one. I'm going to claim credit for that one today.
That.
Yeah.
That's a good phrase to describe what's out there, and also just taking advantage of the fear and the anxiety and the need to control a situation that a patient might have, right? When they're faced with symptoms that they can't explain, and sometimes even their doctors can't initially explain. So I understand why people will reach for that, but that's terrible. All right, that is really interesting, and I'm fascinated by this entire concept, and I'm going to have to do a deep dive on parasite cleanses.
Oh, absolutely. You're going to love it too, because they've got some great eye ones, ophthalmology stuff about it too, about the parasites living in your eyes, and you got to cleanse them. So go for it.
There is one parasite. There are lash mites, but people don't want to hear about the lash mites. That one is not one they want to take care of, because that's icky to them. It's probably some other one. I'm literally going to write that down. Okay, you and I were chatting before we got started about how we both share this passion for community service and involvement. And I love the things that you are a part of. Could you first just tell us about which nonprofit organizations you have chosen to give your time to? And then why did you make that kind of time commitment? We are busy, obviously. I know why Big Brothers Big Sisters and Make-A-Wish Hawaii are important to me, but I want to hear yours and what drew you into this field in a very different way.
Yes, absolutely. So I guess when you try to break it down, people do ask me this, because I thought this was normal, I guess. And then I'm shocked that not everybody just desires to do this. And so I really feel very fortunate for where I am. I'm a first generation college student. You know, I paid for my schooling all through myself. I've really gotten to this point, maybe with a little bit of a difficult journey, and built it up myself. And I sat here and I say, I need to give back in some way. So my way to give back is, through medical knowledge or volunteering. And so one of the things I have a passion for, as we touched on before, would be definitely the women's health. And I think if you have a passion for women's health, it really does translate over probably to pediatric care as well. Women, children, babies, those that really are the most vulnerable in our community. So one of the organizations that I got involved with is a local nonprofit called the Lubbock Children's Health Clinic. It is a 100% nonprofit here in West Texas that serves pediatric kids, mostly unfunded or Medicaid kiddos that really don't have a great medical home. So we take them and do a full scope pediatric practice with them. We have one physician and a couple APPs that practice. We never turn away somebody for inability to pay. And we take care of whole families at the same time with that too. So you've got to think that if you have a mom, and let's say they have a $5 copay, but she has 3 kids that all need to come in, and then there's vaccinations, and there's going to be prescriptions. There's a lot of things that they need really help with resources. So I work on the board. I've been the president, the vice president, one of the chairs for marketing and fundraising. I've worn a lot of different hats. I'm the immediate past president currently. And so I've been on this board for about 7 years, and I really find it one of the most valuable, rewarding experiences, because I get to see where every single dollar goes that comes in and goes out. I get to have a wild idea about how we should, we have a diaper depot. We should partner with the Mother's Milk Bank. We should provide free ophthalmology services. We should partner with some of our specialists. We should have an optometry clinic for just glasses for these kiddos, because they can't afford those things without these services. Mental health care is an extreme issue, especially where we live. There's very limited access. So we are bringing on a part-time LPC to come in and provide counseling services, both individual and family counseling on site. So there's a lot of things that we are trying to do, and it's really amazing to do it on that local level. And bringing my, experience, expertise, and my relationships in the community back together to this clinic, and make sure that it has the connections it needs with those other specialists, with those other big hospital systems, so it can really thrive. Aside from that one, March of Dimes is a really big one. I've been on their West Texas board for that one, helped with their fundraising. That's kind of comparable, more to that bigger national group like Big Brothers Big Sisters or Make-A-Wish as well. I also serve for the Laura W. Bush Institute for Women's Health. That one is more of a research and focused board. I'm on their community advisory board, where we create events that are targeted towards women, and especially some young women, women and girls trying to go into STEM education. I love that, trying to promote that some more as well.
I love it. And you're so involved, and I love just the mix of everything that you are doing and offering your time and your valuable expertise. How did you start? Because that's a question I get a lot of. And I was really surprised. And I know one of yours is very medical. I guess March of Dimes is as well. But I bet you found, like I did, that there are not a lot of physicians on these boards. It's a lot of other different types of people. So how did you even get involved in this way, not just volunteering, but becoming a board member?
I think that's a really good question, because that's exactly what I thought too when I first decided I would want to do this. I didn't really know much about boards. Again, I'm not, in physicians, they don't teach us about that. Medical school residency, that's not something you know about. Maybe you've heard about somebody sitting on, the American Medical Association something as a delegate. We don't know about boards or true volunteerism in the community. And it was really some people that I know that were not physicians and hearing about their experience. My husband sits on some volunteer boards. And so I was like, that's kind of cool that you do that. How did that happen? And one of the things is just being involved yourself as a volunteer. That was the biggest thing is, I was talking with other people who volunteer for other organizations, attending events. I've attended the March of Dimes event every year for the past, going back almost a decade. So just seeing, okay, once you know the people who attend those events, you can see, how can I just volunteer my time? Eventually, if you are an active volunteer, sometimes you may meet the people that say, hey, do you want to serve on the board in that position as well? So I think for somebody who's looking for that experience, I don't think always just saying, I just need to be on a board. I remember thinking that. I was like, I want to be on a board. I want to be important, right? But it's how can you truly give back? And so start by volunteering for an organization that really you have a passion for their mission. You can't just pick something, and if your mission doesn't align, you won't be a great board member either. But like you said, once I got on some of these boards, it was shocking that I was the only physician most of the time. And then now I've kind of brought in a couple physicians too to be on the board, especially for some of these medically oriented ones, because it's so nice to have those voices in the room.
It is. And it is really shocking to me that there aren't more of them, because we help guide the discussion. The experiences we have just give an overall framework, especially for these more medically inclined boards, but even when it's just dealing with children, right? We deal with kids every single day. I'm not necessarily, you don't have to be a doctor to do it, but the kinds of interactions we have just in our community, right? The whole breadth of them, I think is so valuable. And I found this really interesting. I was talking to a lawyer friend of mine who sits on several nonprofit boards in our community. And she said, as part of her law firm, they are basically recommended to join at least two nonprofit boards. There's kind of this expectation that they do that. And I thought that was very interesting.
Our hospital here, I know for a fact, requires their executive level, or at least their vice presidents and things like that, their administrators, to sit on certain nonprofit boards. And now none of those are actually physicians. That's what we're talking about, more administrators. So they have this expectation that they should be on it, which is very interesting. But there's no expectation of the physicians to do it, which perhaps that's more that they think that our plates are full with just our job that we are. But it's a good example of, I had talked to my boss not that long ago, and I had said, we kind of just had this discussion, when's the last time you talked to a physician and asked them what their career goals were? And he kind of paused, and he's like, well, why would I do that? I said, because I told him, I think that most people who, especially are in executive and administrative non-physician levels, think that becoming a physician is the epitome of your career, right? You made it. Congratulations. You're done. Good for you. This is all you ever wanted in your life. And then you're like, we are thankful. We're so appreciative. We're proud of what we've done. But there's so many dynamics to being a physician that goes well beyond just sitting in your clinic or just doing your rounds and going home every day. And I think it's something that's really interesting because it can bring more fulfillment to you as a physician if you have some of these other avenues. We sit there and talk all day long with our physician friends and complain about some of the things in medicine lately, right? There's too much paperwork. There's too much insurance issues. There's too much administrative burden. And then, we kind of don't have these other things that serve as an outlet that really show you that you can be a physician and have this wonderful relationship with your community that's beyond what you could probably have pictured.
I love that. And I think it's hard, right, for us because we're busy and we feel like, all right, we're done, right? We're done with all the little steps we needed to get here. And sometimes it can feel daunting to have another request for your time. And that's also where I think, I don't know what season of life you're in, but I think that we're all built with different seasons. I certainly wouldn't have joined nonprofit boards the first decade into practice. I had to really concentrate on my kids who were super young and building my practice and my clinical skills and my surgical skills and all of that. And I think now that it's been 17 years, 18 years, all right, I've got the medicine thing down for the most part. Now I can just start to do some other things. How about you?
I feel like, I've had a little bit of a different journey because I kind of jumped into it, honestly, like my last year of residency. So I did start it early, and I feel like I was, I maybe was not prepared. And I think I had some learning things to do, but I also feel like it was a great outlet, and it taught me a lot for my job right now. I think that my relationship with some of these underserved populations in that, like that clinic. So let's say my clinic, let's say I can't accept any new patients, or I see some family members that need some assistance for things that I can't provide because I work for a system, and everything I do mostly revolves around insurance. Well, I have these access to these resources because of my relationships with these other areas in the community. So I often refer a lot of patients to, like the Lubbock Children's Health Clinic, or for March of Dimes. I have helped them get in connection to some groups that I work for currently in my hospital system and said, hey, where can we find a partnership? How can we make the money that they raise directly benefit our community where we are? Or for, the research institutes. And I could say, I've got an idea. Because I saw a patient that had some issue with, breast cancer or something that was related, that aligned with their mission. How can we bring that to the table? And so I did start it early, and yes, it's a lot. I have two kiddos as well that I had both of them immediately after getting out of, getting into practice. It was on my own, being attending and having kids, and having infertility struggles, even myself as a woman. So there's a lot of stuff that I've gone through. And I think it just reminds me that going to clinic day in, day out is a wonderful thing, and I'm very proud of it. But I think I'm a better doctor in my clinic, taking care of my patients, because of my volunteerism and my engagement in the community. It feels like I know what they're going through, and I'm not siloed just in this idea of what I see in my clinic every day is all there is out there.
I love that. And I love that also your experience is very different than mine, and we both make it work. And I think that you show that you don't necessarily have to wait the way I did, and you can just jump.
I think both would work. Definitely, I think both would work. Yours probably was smarter and maybe a little less stressful, but I think it's great, and it's all about what's important to you. Because I have some friends that are newly moms, little kiddos like mine, and we sit there, and one of my friends this is the last thing in the entire world she would want to do is do this volunteering. But I can see it now that she's getting more comfortable. She's kind of like, that does sound like something, because she has amazing skills. And I can see that. And so I was like, let's get you involved. Come with me. And so I think that if somebody were to be invited to be involved and they are not in their season yet for that, don't say no. Just maybe say, hey, can you come back a little bit later? The way boards work is, as you know, is that we're always looking for board members when terms start to expire. So if there's term limits and there's term expirations, or we're having people fall off a board, keeping a running list and just tell them, hey, maybe keep me in mind for the next time you guys are looking for new board members. Or if you're actively looking for a position, just ask and say, hey, keep my name in mind. I'd love to be considered down the road.
I love that. That's great advice, because just because it's not right for them right at that moment doesn't mean it might not be a year or 2 years down the road. So that's truly fantastic. Now, you mentioned you just dove right in. How do you make it all of this fit? How do you integrate all of these different aspects? I don't like the word balance. I'm not going to use it. How do you make your work and life and your volunteerism all fit together? Do you have any little tips or little secrets for people?
I think, and I don't know if it's necessarily a big secret, I'm sure this is more common knowledge or not, but for me personally, I just really remind myself that not everything is going to be 100% at all times, right? It will also ebb and flow. And so I know that, if it's family life that needs the most attention, my little kiddo actually had eye surgery about a week and a half ago. Yeah. My 11-month-old. And so, it's one of those things that if we have to focus on that, then, I tell the board up front, I say, hey guys, I'm going to be a little bit out of pocket over the next 2 weeks. If you guys need something emergently, I may not see it via email right away. I will text me, let me know. Just a lot of being like upfront. Hey, my family needs this. Or I went on maternity leave, last year. I said, okay, by the way, I am still available and maybe I can zoom in for a couple options, but putting that up front. Now, when my kiddos are doing great and everything's easy, then I can also say, okay, this is going to be a little bit of a higher priority this season, or I know that there's a gala event coming up that needs a little extra love and care for that one. So it's all about, again, I agree, balance is not the right word. I almost envision it more like these little scales that and none of them are perfect. And sometimes one's going to be lacking when something abruptly happens. But being upfront with your volunteerism and understanding yourself and saying, hey, I might need to take a quick step back and focus on this for a couple minutes is okay. And I think a lot of these boards are really thankful for you to be involved in it at all. And so as long as you're there and when you are there, you're engaged. Because that is one thing I think, and I'm sure you would agree with this, is if you are not on the right board or volunteering in the right capacity, you don't give 100%. And so, and you just really need to be there and engage with something that has that, again, that mission alignment. What does your passion has to align for it? Otherwise, you're just sitting in a board meeting, smiling, saying, okay, sure, writing down some notes. I mean, you're just a body in a room. You really want to give that full presence when you're there.
Okay, I love what you mentioned, and I'm curious if you do this with the medical aspects of your life. You talked about almost basically setting some boundaries in a very nice, professional manner, but not necessarily trying to do every single thing, but saying, I will be back, I will. Was that difficult when you first started having those conversations? Because I think many of us feel like we have to say yes to every opportunity. It's something we all struggle with. And I think especially when you're younger, you feel like you need to say yes right out of the gate, right? When you finish training, you feel like you have to say yes to every single opportunity that comes your way. And then do you utilize that in your work environment, in your medical environments? You tell your higher ups those kind of same things.
Definitely. And I think that it is something I had to learn because I 100%, I am a very type A personality. I want to get that done. I also see something and sometimes I'm like, I think I could help and I could fix that. But that doesn't need to always be my responsibility either, right? When there is a true need for it, great. But also you don't have to say yes to every single thing you get invited to. Yes, you should be honored and flattered if somebody invited you to sit on their board or really thought of you for this, but you really have to tell yourself, does it align with my mission? I've been asked to do a couple interesting things lately and I really had to sit there before saying yes, did it align? One of them is I'm the team physician for the Texas Tech Lady Raiders basketball game. So that basketball team. So being a team physician is not something that was ever on my bingo card for any point in time in my life. I am not, that's the last thing. I know nothing about basketball or anything, but the more we looked into it, the more we were talking, it was all about women's health. It was really caring for women that and they needed a female physician who was willing to talk about some of those maybe difficult conversations sometimes, someone that can, really be attentive to their needs. And as it turns out, it really aligned with my passions. And so that was a job that I had absolutely no idea would ever do. And now I'm engaged doing that too. So you can say no to some things, but make sure what you're saying yes to really aligns with your goals. And so I guess that one kind of answers both things because in the medical sense for that job, it's been wildly entertaining. It's been really a fun experience. The women are amazing. I never even the world thought, working for the Big 12, in NCAA athletics or a D1 school would be anything I'd even remotely be qualified for. But it was been so wonderful because I'm helping women at their, with women's health needs. And it's really great.
I love that. I feel like I could talk to you all day long about everything under the sun, but we are coming up, closing our time. And I wanted to ask this very important question that we ask all of our Pinnacle guests, especially since you have been to, I think, every single Pinnacle conference except for the one where you had your baby, right?
Yes, I have been to all of them except that one. I guess my baby was about 7 weeks old. And so I was trying to debate whether I was going to bring him with me. And I was like, okay, I'll just have to wait till next year.
So what would be your one Pinnacle pearl that you would share with other women in medicine?
Oh, let me think about that. Truly, a shout out for Pinnacle because I think the experience that I've had there has really helped shape me as a woman in medicine and given me more confidence to do crazy things like be on podcasts or start a podcast or all these other things. But I really would say just go for it. And I know that sounds like something very cliche that everyone say, but really go for it. If your mission aligns, if the passion is there and aligns with what you feel defines you, what brings you joy, then go for it. Even if you don't think you're qualified, go be a team physician, go start a podcast, do something. If it feels like it's the right thing for me personally, that's helping women, helping adolescents, kids, really promoting that health, especially those who may not be able to find those resources elsewhere, then go for it.
I love that. I think that's wonderful advice because you've got the caveat. It's not go for
Right.
every single thing.
Right.
But mission aligned. I think that's so important. You've got to know yourself. You've got to know your values. You have to know what drives you. So that's just good in so many different ways. Dr. Gray, could you share with us where people can find you online and in person?
Absolutely. So obviously on all the fun social media platforms, but follow me on Instagram at Dr. Dr. Jessica, Jessica Gray, Gray, MD. On Instagram, TikTok, wherever. You can look up jessicagraymd.com for the website. And we also have a podcast as well called the Med Edit Podcast that provides a free CME to our learners as well. So lots of fun stuff.
I love it. Thank you so much for being with us today. I am sure that our listeners got a lot of actionable tools that hopefully they'll start implementing in their daily lives.
I hope so. Thank you so much for having me.
Thank you.
Thank you for listening to the Pinnacle Podcast, where we strive to elevate the voices of women in medicine and inspire excellence across the healthcare landscape. Until next time, keep reaching for your pinnacle.